where they can be insured by paying for a premium, then that in itself saves money. But if we continue to allow this system to go on and the emergency room becomes primary care for them, the cost is going to continue to go up. Parkland Hospital last year had $513 million of uncompensated care. That goes to the taxpayers. And I feel certain that if people had access to some way to pay for it, they'd be willing to do that. And the only way they're ever going to be able to do it is through insurance. But our insurance companies have not been that cooperative with this. And I don't know what that answer is, but how do you see the relationship of physicians and insurance companies now?
Well, I think as I was saying before, that physicians, often have a daily struggle with getting reimbursed from their private insurance. But we also know that there are a lot of great organizations that have driven innovation. Places like Kaiser, places like Intermountain Healthcare or Geisinger. There are places that have really looked at the whole system of care for our patients and said what makes sense and how do we do this in a smart way so we get patient-centered care, so that people are well cared for, and we actually save money as a business. So there have been businesses in private insurance that have been truly successful in this and can provide good care and do and run their business. So we're not in the we're not always in favor of scrapping everything in private insurance. We want to just learn from those places that have done it well and make that the gold standard.
Yes. And where it has been done well, you can pick that up right away. And patients really are pleased, and they should be able to keep what they're pleased about. It is the situations that kind of dumps everyone else out into the hands of the taxpayers, and that's what makes it so costly.
Well, and that's why I see this is only one step in terms of addressing the concerns in the healthcare system. There's no one magic bill, one magic piece of legislation that's going to fix this all, right?
And it's not going to go in all at the same time.
Right, exactly. Of course. So and physicians know that, patients know that. I think the entire country recognizes it. But do we need to take a first step? Absolutely. Do we need to get everyone into the system? Absolutely. So that we can assess where we are and that we can think more about being patient-centered, about how to be smarter with our dollars and things like that. So,
and there could be adjustments as we have the experience of dealing with
We'd like to learn. I mean, as physicians, and nurses, we want the evidence, and if we see that things are going well, great, let's expand it. If we need to make a mid-course correction, let's make that as well. So let's look at evidence and do the best thing we can for our patients.
But we must do something.
We have to do something.
We've been talking about this now for 40 years. And I hear people saying, why are we rushing into it?
Yeah.
We have really not done much rushing. What we have done is allow it to continue, and it continues to get worse.
Right. And we can't, there are too many examples that I hear from physicians around the country and patients. This is a historic time where actually, if you look at all of the physician organizations, the big physician organizations are all really on board here in terms of reform. That has not happened before. So you know that this is a necessary first step because they are really on board and working hard, all the different physicians organizations, to support reform because it's gotten bad out there for our patients and it's not acceptable.
And hospitals are pretty much on board too. There's a kink that I'm trying to work on, and there are some hospitals that have private-public partnerships where physicians have invested some. I have purposely visited many of those to see how they're working, and it seems to be a great option to have because some of the, Texas is so spread out, and there are many areas that would not have hospitals at all if they did not have that extra help. And I've interviewed patients, and they seem to be very pleased with that. So there are things that can work if we allow them to.
Right. And there's a lot of things in the bill also to invest in rural health,
Yes.
in terms of encouraging doctors to practice in underserved areas and rural areas, and in terms of promoting things like telehealth, like we were talking about with calling patients and things like that. So, I think that especially patients in Texas are definitely going to be helped by this kind of reform.
Yes, Texas has a very broken system, and we have the largest number of uninsured people and the largest number of uninsured working people, because many are working with minimum wage, don't have access to even paying for a policy, and so it would mean a great deal to Texas as a state and to the practice of medicine and for the patient. We are getting in lots of trouble with patients simply because we don't have the records. They live long distances from getting care, and often they don't have time to go 25 and 30 miles and sometimes even longer to some place they can get attention. So they wait until they're really, really sick. And sometimes there are deaths without it being necessary if they had the intervention earlier. Nothing really is more important to me than seeing this system change, because all of us would be better. Instead of saying how much it would cost the people, it's going to really save money. You've got to spend something to get it set up. But once it is set up, I think the taxpayers will see the difference. We don't want the dollars hidden so they can't see it. But the hospitals that are treating uninsured people would see relief. The patients who are getting the care would have better access at an earlier stage so they can look forward to better outcomes. I just think that the time has come, and all the false information and the misconception that's going on is so unfair to America, because it is the American taxpayer that's picking up the dollars for this broken system. I hope we'll continue. I don't want to stop. I don't want to give up. I'm not one of these people that say, oh, well, we can't get it and throw the towel in. This is something we need to fight for to get it done. It would be better for everyone. And I hope that people will make an opportunity to learn what the real facts are and not listen to a lot of misconceptions. I'm trying to do my best to work with my colleagues so they can get the right information. I don't know if I'm doing really well.
Well, I appreciate your help. We're trying to work with our colleagues and the physicians around the country so they have the right information and are armed with the facts so that they can talk to their other colleagues and their patients about this. So thank you again for all the work you do.
I've had electronic town hall meetings, and I've had several other in-person town hall meetings, and people really do have serious questions on some of the things that they've heard. And it's unfair, actually, for them to hear these things that are just totally not true.
Right.
But it was not going to happen overnight. The problem didn't come overnight. It has to be phased in. It has to be some planning. And I think that for the most part, the people in this country are ready for it. We need to remove all the myths and the untruths from the system and try to correct it. It's better for America. What do you think?
I agree with you. Well, thank you for your leadership on this and for inviting me here today.
Well, thank you for coming. I really appreciate it, and I appreciate the efforts that you've put forth to educate people as well. And I think this is the greatest opportunity that we've had in some time. So thank you again, and thank you for watching. And I want you to ask those questions that you need answers, and we will make a special effort to do that. We do not want you to get false information, have questions, and be frightened. We want you to get the correct information. So call me, call my office. I want to answer those questions. See you next week.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.